Hello, hello. I think I've gotten all the kinks worked out in my recording setup. The audio should sound good quality. So I'm going to go ahead and scroll up here and start from the top. I'm not yet live. Once I click this record button, my webcam will start broadcasting. I hit record and I should pop up down there. Excellent. It works. The registry I'm going to focus on today is the T1D Exchange Registry. It's a disease-focused registry for type 1 diabetes. Its goal is to capture an accurate picture of type 1 diabetes management, progression, and outcomes. And so, how does it all work? T1D, it has three products and three customer categories. Their biggest product is the data set that they produce. And their next product, which I'll talk about in a later slide, is they have quality improvement contracts with clinics that are paid for through CMS, and CMS is the Center for Medicare and Medicaid Services. Henceforth, I'll just call it CMS in this presentation. And their last product is for patients. By signing up on the registry, the patient can get access to clinical trials and improved care outcomes. And so let me back up just a bit. So the data set, how it works is prior to 2019, T1D exclusively contracted with endocrinology clinics. And at each clinic they were contracted with, they were conducting pen and paper questionnaires. And they get sent over to T1D to compile the questionnaires. A statistician would run it, and you'd have your data set. And they make profit from selling this data to drug and device developers. And so, that's basically that slide. So how does T1D choose a population sample? They have three requirements. One, you have to live in the US. Two, you have to have type 1 diabetes, and you have to currently take insulin or have a pancreatic or islet cell transplant. And so T1D, this is what I mentioned before, prior to 2019, they used pen and paper surveys. Now, after 2019, they switched to a freely available online website. And so their primary intent was to increase statistical representation amongst underserved type 1 diabetes populations. And so these populations don't have access to these very expensive specialty clinics. And so I've noticed on a number of health websites that they'll advertise like in online magazines for people with type 1 diabetes. I have an example on my desktop I might pull up near the end. And so, but now it's just one website. You don't have to go to a clinic. You can just self-select, put yourself in with the benefit of the patient will have you'll have access to clinical trials and new products, and that would be the benefit for the patient. And so their guidelines for data collection, very first one they mention is you have to obtain informed consent or assent if it's a minor, which the parent agrees. And so the types of data they request, they have 11 categories of data that they're interested in. And in some of my research, they go over why in this source in particular. This is a scholarly article, and they go over the points in detail. I will leave it at that. And so, is there accreditation or certification? And so, it's not like a cancer registry where people administering the registry have to have lots of certifications. The only thing about certifications and accreditations relate to CMS and its involvement in CMS. And so the program's name is HQIC, Hospital Quality Improvement Contract. And so it's a federally funded program where a hospital that qualifies can pay to hire a quality improvement contractor. And so in this case, it would be endocrinology clinics can further participate in another quality improvement program. I think this would supplement and not replace the Joint Commission in all types of accreditation. And so this registry came about in 2010 from a grant from the Hemsley Charitable Trust. The Hemsleys were a notorious billionaire couple in the 70s and 80s. I believe they owned the Empire State Building, and they owned several luxury hotels all over the world. So they made billions of dollars. And I believe the foundation has four trustees, and the four trustees opted to fund this project. And a big reason why they would choose to fund this project is, even in 2010, there was no national scale uh, registry for type 1 diabetes, which I was incredulous at that at first, but as I looked more and more, it seems to be the case. A lot of the data was scattered, and I assume to keep it local here in Indianapolis, companies like Eli Lilly, who have a big diabetes and insulin manufacturing plant. I apologize. Let me go back. And okay, and so companies like Lilly, they'd pay to get all this data through different means, and I included this quote here from Dr. David Kerr, and um, and so there was no centralized registry in our country, and so this one is it's a private investment. Its aim is to make money, make profit, create wealth, but at the same time, it's proven to be incredibly useful for gathering data on this, small but important and clinically profitable group of type 1 diabetics. And so, if you ask me, the author of this presentation, what I would prefer, it would be a national public health registry. I think it would be more effective. Those are my references, and that's the end of my presentation. Thank you for your time.